Good morning, Peter Goertz. I'm a psychiatrist. This past week, I saw a patient who really, with her constellation of symptoms and the whole situation, created a situation where I felt very sad after I saw the patient. So let me explain. And this is about unborn children and the role of a psychiatrist in addressing the issue of unborn children in psychiatry and in medicine in general, I guess. So I saw a pregnant patient, and she was quite far along in her pregnancy, but not going to deliver anytime soon. She was using drugs significantly. She had major mood instability, a major mood problem, not stable psychiatrically, and she had a major medical problem, which she was not getting treatment for, not taking her medicine. So all that was the reason for her presentation. She was admitted to the hospital, and the plan was to send her to a psychiatric hospital. She was initially on the obstetrics ward for medical stabilization of her medical problem, but the plan was to send her to a psychiatric hospital. However, once the drugs got out of her system, she became psychiatrically stable. So legally, we did not have the right to send her to a psychiatric hospital anymore. So we discontinued the order for her to go to a psychiatric hospital. There was no legal ground for us to force her to go to a psychiatric hospital against her will. And she expressed willingness to start substance abuse treatment regularly in a program, Monday through Friday, daily. So that's the mother. And I felt very sad after I saw this patient and realized that we were not going to be able to send her to a psychiatric hospital. Not that I wanted to force her to go to a psychiatric hospital for no reason, but what made me feel sad was the unborn child. So the patient, after discharge, may well have started using drugs again, may well have stopped her medicine for her medical issue, which could have endangered in itself also the fetus, the unborn child, and of course, she could have become unstable related to her mood, which of course is also a major problem for the fetus. And I realized that the fetus was at a major risk because she had good intentions. I think she wanted to follow up with her substance use program. However, it would have been entirely possible, and I don't know the follow-up, that she did not follow up, and that the unborn child would have been at risk of her, the mother, taking drugs, not being medically stable, and not being stable as far as her mood. So what is the best course of action for a psychiatrist to take in that regard? I was wondering. It was a situation I had not thought much, if at all, about previously. And the issues are not legal for me because I'm not a lawyer. I'm not going to address the legal issues, but medical and ethical. So medically and ethically, what can a psychiatrist do for an unborn child who's at risk, at major risk of potential harm, and may have already been harmed by the behavior of the mother? So if it's one person, that's very common. Let's say an IV drug user goes into a hospital, receives antibiotics for a heart infection, endocarditis, and that takes weeks and weeks and weeks. And finally, the patient's discharged after successful treatment of the infection, or at least initiation of successful treatment of the infection. And then the first day after discharge, the patient may again inject, let's say, heroin or methamphetamine with a used needle. So after all that investment of weeks of treatment, the patient may go back to using intravenous drugs with needles that have previously been used by other people. So that is relatively common, that type of scenario. And we don't have the right to prevent people from self-destructive behavior like drug use in our society. And these are, again, legal issues, but also ethical and medical issues. But of course, we want to maintain people's freedom as much as possible. Freedom is a very important thing. And we also want to maintain as much as possible a mother's freedom to take care of her child, including her unborn child. So, this is a very difficult issue. The life of an unborn child can be affected, like I mentioned, by alcohol, drugs, psychiatric instability, medical instability, and those effects on the child can be permanent. For instance, there's something called the fetal alcohol syndrome, including facial features that are unusual, but also intellectual disability. So these effects can be very significant. So what can we do? What we can do, as far as I can tell, as a psychiatrist, what I can do is to do my best to prevent harm to the unborn child, but also to realize that in many scenarios, I do not have control. And again, freedom is important, but it's also sad for me to see potentially unborn children coming to harm. So there are some scenarios where we can help the mother and the child. For instance, if the mother is psychiatrically so unstable that she requires psychiatric hospitalization, then we can put her in a psychiatric hospital and at the same time hopefully prevent her from using drugs, hopefully prevent her from stopping her medical medication, and thereby hopefully help the fetus. Another possibility of the mother getting treatment and thereby the fetus being helped is court-ordered psychiatric treatment. If something is in place for that, there are certain programs where chronically ill psychiatric patients, for example, are court-ordered to cooperate with treatment, take their medicines, and if the patient's in a program like that and pregnant, then that can help also the unborn child. Another potential option is court-ordered substance use treatment, and that is also a possibility if the pregnant patient is in the criminal justice system, but if not, then we're not going to get court-ordered substance use treatment. So a judge can order that, but a psychiatrist cannot order that. So we're left with a situation, and life can be very sad, and we want to acknowledge as psychiatrists that there's a lot we cannot control. And again, freedom of people is very important. We want to have maximum freedom for mothers, including pregnant mothers. So there are some sad things, and we are not necessarily able to exert control over things. And we just need to accept that, in my opinion. So this is a situation and a case history that illustrated that for me. Thank you.